Hi everyone, my name is Carolina Farias, and I'm here to talk to you about, let me get my screen, sorry, about my expert interview, which is my portion of the project. So let's see, I'll start by telling you a little bit about a company that I found, which is the Healthy California Act campaign. It's interesting because they have about 6 million Californians that built the statewide movement to guarantee healthcare for all California residents. They represent 350 communities and labor organizations made up of nurses, teachers, patients, doctors, unions, so on. So it's a huge organization. And the reason I chose them is because my interviewee, the person I chose to interview, is Peter Kahn, and he is a primary representative and organizer and volunteer since 1996 with the HCA, Healthy California Act campaign. He gave me tons of information. We interviewed twice over the phone, and it was very inspiring to hear him talk and how devoted he was to the Single Payer Act. Let's see. So just to give you some information that he provided me during our 2 interviews, basic information, single payers known as the as Healthy California system would just cover everyone, just like Medicare does. Anyone over 65, it would work the same way. Single payer would cover everyone residing in California, regardless of your documentation status. Single payer would also make the system more affordable by increasing administrative costs and lowering the cost of drugs through negotiation of prices and lowering the cost of providers, what they charge you overall. Additional things would come from reducing the use of unnecessary services, pre-existing conditions, same as the current healthcare, which is there is no such thing as pre-existing conditions. So if you're alive and can provide proof that you're a resident, then you would be covered. And finally, single payer would build on a nonprofit model. All right. Okay, so one of the questions that I asked Peter Kahn was who would benefit most from this single payer? And the medical system as a whole was mentioned. He said that the money now used for profits, paying high CEO salaries, administrative expenses would now be used to benefit the patients and to include lower costs and benefits overall. The patient would also benefit from this by providing care for all, documented or not. Clinics and hospitals would benefit because they would be assured payment for everyone. Inflation rates would also be lowered, and rural areas would also benefit because areas that have a tendency to have few practices or few physicians that want to open practices would now give them more opportunities and encourage inner city practices to open up. I also asked Peter Kahn about who benefits the least from single payer. He mentioned drug companies would make a lot less profit, but they wouldn't go out of business necessarily. Insurance companies would possibly would also benefit least from this. They would now focus more on policies that would cover the extra costs instead of just the basic costs. So things that were unnecessary, like private rooms in hospitals, cosmetic surgery, or health insurance overseas would be things that single payer would not cover. And also some hospitals that pay above normal charges would benefit least from the single payer insurance because they wouldn't be forced to bring down their prices. Okay, so how easy is it to access single payer? Well, there is no exclusion in single payer if you're alive and can prove that you're a resident. Again, you would be covered, documented or not. Single payer would be built on a nonprofit model, which means transparent governance and pricing, and focus would be on what's best for patients and those who provide care, and not how much payment would be, the payments for services would be. Single payer would also be, people wouldn't pay premiums for various plans. They would pay taxes based on their income and get all one plan. Also, everyone and every business paying into the system, so the cost would be less for everyone. and people be able to go to any doctor or any hospital that would accept healthy California single payer insurance. So that's easy access, I believe. Let's see. Okay, so then just going back to one of the slides that my teammates had mentioned previously. So let's see, Miley in slide 2 had mentioned, brought up this slide here. It was in her introduction position statement. And I'm mentioning this slide because Peter Kahn had mentioned that there is no market currently for that can be created where people have a real choice of whether to buy or not. For much of the poorer population, this is a huge issue. So buying is no longer an option due to high prices and unregulated fees and services. So this was very spot on to what the research that Miley had mentioned. Let's see, slide 5, something that Nida Buxton had mentioned in her PowerPoint. She compared the current healthcare and the single payer in terms of just complexity and how it works. And the expert interviewee, Peter Kahn, was in support of this comparison by mentioning that the Affordable Care Act, which is our current healthcare, expanded affordability by creating insurance exchanges where people who didn't have insurance could get coverage with various qualities of benefit packages. Those premiums would be based on the benefit package, and then the subsidized portion would be taken care of by the federal government. So it would be based on income, family income. In contrast, the single payer, which is what we're hoping to get, the single payer would make the system more affordable by decreasing administrative costs and lowering the cost of drugs through negotiation of prices. Lowering those costs for providers by having only one insurance plan and one insurer to deal with. The slide number 11, which was created by another one of my team members. This was a comparison. Oops, sorry about that. Team member who spoke of how other countries manage their healthcare. She compared German and Canadian healthcare, and our expert interviewee, Peter Kahn, mentioned that looking at other industrialized democracies, we see that they pay less, get more, and have better overall outcomes than we do. They're not all single payers, but they all manage costs and negotiate with providers better than we do. And they have, by setting prices and just regulating costs and services. The final slide, the final slide that I want to bring up again is, again, the comparison of here, the German, Swedish, Canadian, and French cost for a single payer. And here, Mr. Kahn stated that those countries that pay the least for administrative costs seem to be those with single payer and with no or very little private insurance. Those that have private insurance involved tend to spend the most of their health care because of the increased cost of administration. So I think we all agree that we need to get everyone covered. So the next step would be not necessarily find the insurance that works, but the care that works for our population, so that we can deliver the best care at the most affordable cost for both rich and poor. And that's it. Thank you very much. Have a good night.